Questions over the future of the health sector as major donor partner that need withdrawal support to Ghana beginning next year.
We think that it's the right time for us to decide that now Ghana can go on without our support, and we will spend our money for development cooperation in poorer countries.
Meanwhile, the coalition of NGOs in health is warning of dire consequences when this decision takes full effect.
Then that will also be greatly affected because we already do not have core funding. So we normally base on writing proposal for support and getting the support for a specific period, not just like what government of Ghana enjoys. And so we are greatly affected.
Tonight, we explore the real implications of this move by the Danish government and get a response from the Health Ministry. This is today's big story with me, Kwache Afreniama. 22 years, they have provided support to the country in many areas, particularly in the health sector. They have built CHIP compounds, trained medical professionals, and provided budgetary support to the country. But today, the Danish government has announced that it will no longer be delivering aid to Ghana in those areas from next year. The European nation's ambassador to Ghana, Tove Dengbel, made the announcement at a program organized by the Danish International Development Agency today.
Ghana has been doing absolutely nothing wrong. We've had this very long and very good partnership for 22 years in the health sector. We, as a development partner, have constantly to assess where to put our money. And since we see now that the capacity of the Ghanaian health system is so much better than in many other countries, we think that it's the right time for us to decide that now Ghana can go on without our support, and we will spend our money for development cooperation in poorer countries which have not yet reached middle income status as Ghana has.
Okay, so with this process, does it mean it's taking immediate effect, or it will take some time for you to completely win off?
We have spoken about this for a long time, and it has been very clear that this present funding for 5 years would be the last one. So that we made that clear when we started this in 2011, the last phase. So we are providing our last disbursements during 2016. So you may say that we are now very close to the end of us being a funder. We would still like to be a partner and an ally, and to continue our cooperation in other areas, but not with us in the role of a development cooperation partner.
Okay, so is it just for the health sector, or it cuts across all sectors?
We are gradually phasing out of our development cooperation also in other areas. The health sector program was the first one where we stopped funding, or where we will be stopping funding by the end of this year. We'll continue in other areas until 2020. So you may say it's a very soft landing. We have been talking about this since 2010. We're actually continuing up until 2020 with support to the private sector, support to our tax development program also. You heard the minister saying that now the challenge for Ghana is to raise taxes and be able to fund health sector expenditures itself. And there we are now contributing with a strengthening of the tax system in Ghana.
Okay, so looking at the entire situation, yes, you painted a very good picture of the NHIE that has been running since 2003. But very critically, if you go to the ground, you will realize that NHIE still have some challenges. What are some of these issues that you have identified as a partner that you would hope that Ghana would work on it whilst you are winning out your support?
There are a number of challenges with the national health system. That's the insurance system. There's no doubt about that. I have been myself out in Kumasi in rural areas, spoken to district staff, and I'm absolutely convinced that there are a lot of challenges to work on. I also see the willingness of the Ministry of Health to address these issues. The ongoing study of the national health insurance is a very good tool to identify the challenges. Danida is actually contributing to some of these studies also, because we find it so important that the issues are addressed and rectified. I mentioned in my speech the example of women who go to clinics, and they should be allowed to go there free of charge because they have paid for their NHIS, and then they are turned away or asked to pay additional fees. This is not how the system should be. And it's so important to address these challenges and make sure that poor people in remote rural areas, they actually do have the right to health services.
So that was Danish Ambassador to Ghana, Tove Dengbo. Government has been responding to this development. Health Minister Osei says he is confident health delivery will not be affected.
As a country, we have to begin to, one, educate our people of the situation, but also begin to plan our budgets and our economies to realize that our responsibilities are now greater. And we must also learn to deal with wastage and deal with issues that lead to wastage, so that the little that we are generating can be used to, one, maintain, and then secondly, develop what we already have to take us into a better place that we all want to be. But Ghana is on a good footing. It is clear that there are challenges, but these challenges are necessary at this stage. We are dealing with it, and I think that the health sector, as to where we've come from from the time Danida came in the last 22 years to where we are now, we're not standing on the top of the tree shouting, but we can pat ourselves on the back a little bit and say we've done a lot, there's more to be done, but kudos to us in the 22 years with the Danida help.
Will this winning of support, will it in any way affect our healthcare delivery in the country, looking at the kind of support we have received over the past 22 years?
Well, no, I don't think it will. The whole idea of them being winning as of now is that we have the capacity and we have the ability to sustain what has already been done. For example, 71 trained people with master's degrees. That gives us a wealth of knowledge that we never had. And that is already working for us in Ghana. We must now find ways to ensure that we also train more people with our own money in that health sector, so that as these ones move on and fade out of the system, others are being brought in. But that is our responsibility. We can't let a gap or a void be created. I think that there has always been a good plan. Danida has helped to lay the foundations. We have built as a government a basis to continue what is there already. So I don't actually even see us as stagnating even when that help goes. I see us actually moving from strength to strength.
So that was Health Minister Osei. Thankfully, we've been joined on the line now by Health Secretary at the Danish Embassy, Lena Horthes, for more on this. Thanks for joining us on today's big story, Lena.
Thank you. You're welcome.
Clearly, from what we know, you've been collaborating with Ghana over the past 22 years. I'm wondering why this decision now?
Well, it's not such a decision that is taken right now. The current program that is phasing out here in 2016 was started in 2012. So we've had the last 5 years or 4 years to prepare for this exit. It's been Ghana's wish that to become more independent from development aid, and so Denmark, as an equal partner with Ghana, is taking this wish, and the health sector program is just the first one that will be phased out as the direct development aid.
Lena, I want to get this clarification. You say that this is the wish of the Ghanaian government that you withdraw your...
In the way, no, not that we particularly withdraw from health sector, but the Ghanaian government has a wish to become more independent of development aid. And with Ghana being the lower middle income country it is, and that the health sector has been strengthened so much over the years, the Danish government has taken the decision that we will be phasing out of the health sector and then using our development aid at countries poorer than Ghana.
We'll be talking more about this argument of Ghana being a middle-income country and all that, a major basis for this decision. But I want you to explain to me what this decision means.
For Denmark or for Ghana?
For any ordinary Ghanaian listening now, for the country on the whole.
Country. Well, as the Honourable Minister was also saying, we've been working together with both the Ministry of Health and the Christian Health Association of Ghana and other partners in Ghana in the health sector for many years. And part of our strategy has been to strengthen the system and capacity build. We have had both capacity building through the masters that was already mentioned, through short and longer term courses, and through that we've had technical assistance in both National Health Insurance and the Christian Health Association and in the Ministry of Health, both within public financial management and monitoring and evaluation. So we have been working towards strengthening the capacity of the Ghanaian system in order to...
So what is going to change? What is going to change?
As of the minute we move out, I don't think that for the ordinary Ghanaian anything will change such as that right there and now. I'm not sure. So I don't think that from when we move out until the next day that anything will change.
But a major reason, as I mentioned, your government says you withdrawing is because we've reached a middle income status. But in reality, the health sector has huge challenges, even with donor support.
I agree with that, but you also must know that Ghana, and especially in the health sector, well, I don't know. To be honest, I don't know about other sectors. I know mostly.
Let's focus on health for now. That's fine.
Has moved tremendously forward the last 20 years. And that Ghana is a middle-income country has an effect also on donors, because our goal in life is to support the poorest and to the most vulnerable countries in the world, and there are many, unfortunately, many poor and vulnerable countries in the world. And then now Ghana has moved up in the hierarchy, if you can say so, which then you could say, unfortunately or unfortunately not, depending on the view you have on it, has an effect on development aid.
I mean, I was talking about the reality on the ground. If you go to the major health referral facility here in the Greater Accra region, for example, the Kolebu Teaching Hospital, real difficulties there. The ICU there has been shut down for 2 years now.
Yes,
these are the real challenges on the ground, even with donor support.
I agree completely with you that there's many challenges. I mean, we are still here the rest of the year where we are giving our support to the mental health and trying to upgrade clinics we are paying for procurement of equipment for clinics around the country in order to upgrade so women giving birth, hopefully less will die during the next year. We're not finished here yet. And also, I think that even though I agree with you that there are many challenges, it's also up to the Ghanaian government to face some of these challenges. And we have, through our cooperation, could be then, if we say 5 more years or 5 more years, I mean, it's up to the Ghanaian government to take the responsibility of the people. We are, for example, still continuing to support Ghana in other ways, which will also hopefully have an effect on the health sector. For example, we have what is called tax and development program, where we are strengthening the Ghana Revenue Authority so they can be better at collecting revenues, which can then be used on public sectors such as education and health. In Denmark, we have very nice and free healthcare, but everyone also pays around 40–50% of their income in tax. In Ghana, the percentage is not so high, and not so many people pay tax. broaden this tax revenue, for example, then there's more possibilities for the Ghanaian government to spend resources on the public sector. Yes, sorry.
Very well, I must say we've been joined on the line too by a minority member on the Health Committee of Parliament, Dr. Chum Nyama. We'll come to him shortly, but just before you leave us, I'm wondering again what you make of how the funds and the support funds particularly you've provided to Ghana over the past years has been used. What's your own assessment of how it's been used in the health sector particularly?
Well, we think that we've done a great job, obviously. We haven't done this alone. We've done this in collaboration with both Ghanaian partners and other development partners. But we have tried to, the first years we were here, we focused on our West region, which has come a long way with infrastructure and communication systems and clinics and doctors. And then the last many years we've been giving sector budget support to strengthen the system, the health system, on a more broadly basis. And we hope that we have succeeded in this so that the Ghanaian government can carry a lot of these efforts forward, that we've helped and assisted to create a foundation to build on.
All right, thank you very much. We'll leave it here. Lena Holtz is the Secretary in charge of Health at the Danish Embassy. We've been joined, as I mentioned earlier, by a member on the Health Committee of Parliament, Dr. Chum Nyama, for his views on this development. Dr. Nyama, thanks for joining us on today's Big Story. You say this development is worrying. Why?
Thanks for having me, and good evening to your lovely viewers. I think this is a difficult situation for us now, because as the lady rightly indicated, they have been helping the Ministry of Health in areas of human resource development, management issues, monitoring and evaluation. So more or less they have been augmenting the goods and services budget of the Ministry of Health over the years. And with this development, you can imagine with already the low levels of goods and services budget that we are grappling with in the year 2016, they taking away their financing is going to put a lot of pressure on the already depleted budget for the ministry. So I really do not really know how the ministry is going to, get the extra funding to come and more or less plug the hole that will be left by they pulling out with their financial.
Well, they say Ghana has reached a middle income status, therefore they have to turn attention to lesser developed countries in that regard.
That is what she said, and I think they have already more or less alerted the ministry for some time now. It's not something that has come in, suddenly. We knew that in the year 2016 this was going to happen. But unfortunately, we've also not been able to make the necessary investment, necessary preparations to more or less make up for the losses. In fact, we have rather even reduced our goods and services budget, as we all, were informed this year. So I really do not know how we'll be able to make up for all the difficulties. I want to wait to see what the ministry will tell us with this, so that we can, scrutinize whatever they will tell us, if it will really help to alleviate the problem that will come out of it.
Well, the health minister, Mr. Alex Segbefia, when he addressed the media after today's program, sounded quite confident that his ministry and government can deal with whatever the difficulties will be.
Well, I would say we will live to see, because already the health budget is seriously constrained. If you recall, the goods and services portion from the government of Ghana was woefully inadequate at 3.6 million Ghana cedis as compared to over 800 million Ghana cedis in the previous year. And the ministry has admitted that it will not be able to do anything. They have told the various agencies that they will not get any subvention as far as goods and services are concerned. So if the minister is telling us that they are okay, I don't know why he's saying that. So we will want to interrogate his assertion deeper to see the strategy they are going to put in place to ensure that the various agents at the ministry will be able to undertake their supervisory activities that the Danish government was actually supporting. The most important area is the monitoring and evaluation, because that is where they will be able to assess the various health sectors to make sure they do the right thing to achieve their targets. And if they don't have the resources to do this monitoring and evaluation, I don't think people will do what they have to do to enable the health sector to achieve our set targets in the year.
And you're on the Health Committee of Parliament, and what do you make of 22 years, and particularly over the last 8 years, what do you make of how we've used specifically the funding that we've received from the Danish government to tackle health issues?
By and large, it's been quite well, because, as you know, there are stringent, rules governing the usage of these resources. The Danish government is very active. They monitor how the resources are utilized. Initially, they were giving it for specific projects. Later, it became a sector budget support, more or less in a pool that is utilized broadly to, achieve the set targets. So they've always been monitoring the way the resources have been utilized. So I think if at any point in time they had difficulties with how we use the money, they were obviously going to, raise the alarm. But as long as they've kept it with us for all these years, I will believe that they have been satisfied with how we have utilized the resources over the years, as the lady rightly alluded to.
Well, Mr. Sebefia, one key point he makes is that government will introduce more taxes to seal any deficits moving forward. I'm wondering what do you make of that?
Well, already I think it's an accepted norm that we have been attacked. People are complaining. Rightly, when the president spoke in his donation address, he actually indicated that they were going to withdraw the 1% tax on investment by people, which people have complained. So I don't really know what he means by they're going to introduce new taxes. I don't know how it is going to fare, because you can, for how long and for how far are you going to tax the Ghanaian? I mean, can they take it any longer? Will it help? Are you not going to have a disincentive where people will not invest anymore? There will be little, production, little investment, little usage of resources. We will not even have anything. I think taxing us more will not be the best way to go so far. So maybe the minister will have to come again and give us, more details as to how they are going to go to be able to, augment the shortfall that is going to arise from this new development.
You clearly disagree with the proposal of the taxing, but some will say it's a necessary evil. Well,
we are in it together, and already we've had several taxes. People are complaining. Cost of living is really high, and I guess you cannot squeeze water out of rock all the time. At a point, you get to your limit where when you squeeze, nothing will come out. And I believe we all agree that we have gotten to our limits. We've gotten to our wit's end, that I don't think it will be really the right way to go to put more taxes on the Ghanaian as of now.
Certainly, in terms of how government is going to deal with this withdrawal, there's some clarity you feel must be provided. Would your committee in Parliament be interested in inviting the minister to answer questions on this?
Certainly, because this is an ongoing activity. As it has happened, we want to find out, first of all, how the ministry is going to, if you like, prepare itself and make up for these laws, the strategies that they are going to put in place to ensure that they will not really affect the operations of the ministry and all the agencies. So I'm sure as we go through this dialogue and whatever the ministry is going to do, they will tell us, and we also interrogate it to be able to be satisfied with whatever they want to take. And if there's the need to make any input, the committee will do that when the need arises.
Very well, thank you very much. Dr. Chumniama is a member of the Health Committee in Parliament. Well, the coalition of NGOs in health is meanwhile warning of dire consequences once this resolution takes full effect next year. Gabriel Benanko is chairman of the coalition.
With the pull-out of the NIDA, we will also be greatly affected because we already do not have core funding. So we normally base on writing proposal for support and getting the support for a specific period. not just like what government of Ghana enjoys. And so we are greatly affected. But what I think is, even though it's too late, the government of Ghana should have started the process, having known last 5 years that they will be pulling out. They should have started the discussion very early. Let me give you a typical example. Gavi, the Vaccine Alliance, is supporting the government of Ghana on immunization. And they made it known to the government of Ghana that in 2020, they will be pulling out, so where government of Ghana will take total full cost of immunization program for Ghana. The government of Ghana have started a dialogue with civil society on how to come out with a fund so that after 2020, the government of Ghana can take full responsibility of immunizing children in the country. Why we didn't do that for Danida case, which we are already aware, and in fact more closer to Danida than ever. And Danida has been one of the Ghana's best friends in financing our health sector and other sectors. In fact, all the sectors. So I think it's very late. We have not acted very swiftly. We obviously do not think that we need more taxes to be able to sustain our health system. No. What we need to do is to look around the leakages. Leakages in the public health sector.
Leakages, exactly what do you mean?
We are not putting in efficiency and effectiveness into our health service delivery. And that costs a lot. We are not promoting preventive health. We are focused on curative. And I will charge you to investigate. Look at the amount of money invested into preventive health, very minimal. And look at the amount of money invested into curative health, very huge. In other countries, even developed countries, what they have done is to put in more resources into public health, where you can reduce the cost of people seeking for help. So people have very good information about healthy lifestyle. People are well coordinated. Information is given readily. We are not doing that well in Ghana. And their orientation should be focused on strengthening the health system, preventive health, more than the curative, so that, we can save a lot of money there. We also need, as a country, to work together to strengthen and sustain the national health insurance.
So that was Gabriel Benanku, chairman of the Coalition of NGOs in Health. That will be it for today's big story. My name is Kwache Afreniama. Thanks for watching.